I believe the good doctor is on the phone right now.
I believe he is. Dr. Crutchfield, is that you, sir?
That's me.
All right,
Hello.
Happy April Fool's Day.
Same to you.
And happy opener for the Twins.
Oh,
is it today?
Yes, today's their first game, but it's not. Their home opener is back here next Friday.
Okay.
And
super.
where are they today?
I think they're playing in Toronto.
That's what I thought. Canada.
Around 6 o'clock tonight.
Oh my gosh, go Twins!
Go Twins!
Go Twins! All right, so Dr. Crutchfield, when I was there today, I had all those questions for you.
Sure.
So here's a couple things that we're noticing. Everybody asks me about age spots or sunspots, whatever they are, on your hands, on the side of your face, on your neck, on your legs, wherever people get them. What is, there's lasers to take care of this, but how do people give us the non-expensive way and a little more expensive way to get rid of them?
Well, I tell you, if there was a non-expensive way to do it, everybody would just do that and it would be solved.
Well, you're right.
Yeah, but the tricky thing is there's another lesion called a seborrheic keratosis that looks just like those flat ones, and I call this flat ones sun freckles. They kind of come with sun exposure over time. The medical term is called actinic lentigine. But there's another lesion that looks just like it, and the only way sometimes to tell is to do actually a biopsy and look at it under the microscope because it has completely different treatments. And so I see this all the time. Patients will come in and they'll have what they commonly refer to as liver spots on the back of their hands or their legs or their face, and they're treating it with bleaching agents or freezing it, and it's not getting any better. When you biopsy it, it shows that it's really a keratosis, which can't be treated that way. So the main thing is to make sure that's what it really, really is. But if you're going to treat it, I like topical lightening agents that contain hydroquinone, but it's a little slow process. It's twice a day for 3 to 4 months, and you have to combine that with meticulous sun protection. Otherwise, you can get them to fade away, and if you go back out in the sun without any sunscreen, boom, they come right back.
And they do in a day, don't they?
That's right. And the other option, you can do a light-based therapy or a laser-like treatment, and that tends to work very, very well. Usually takes 2 or 4 treatments spaced out every month. And there's a thing called advanced fluorescent technology, and that does a great job. So those are kind of the 2 ways of doing it. You use a topical lightening agent or a light treatment, but make sure that's what it really is. It's what we traditionally call liver spots.
There's something that is called I believe it's called a keratosis, but they call them like barnacles that are kind of raised and flaky
what
and
I'm
itchy.
talking about.
Okay.
And those are called seborrheic keratoses, and there's a variety that are just paper flat, and they look just like liver spots, but because they're gross in the skin, you can't fade them away.
Okay, I have one of those barnacles.
Yeah.
That's what my professor in med school, they called them the barnacles of life.
Yeah, are they?
Yep.
Well, at least they're not like skin tabs. Now, people notice a lot of skin tabs, they just start growing out of anywhere, I think, when you start to get older.
Yep. I tell my patients, I call them good deed bumps. Every time you do a good deed, you get one.
And people, can you just clip it off yourself?
You can, but usually what I do is I put a little drop of numbing medicine, and the medicine that I use to numb it up has epinephrine in it, so it causes the blood vessels to close down. So you take it off, it doesn't bleed. Because if you've ever done one on your own, it bleeds like crazy. I mean, all over the place. So I use that, and we kind of cheat, and so we can take it off, and it doesn't bleed. I had a patient in this morning, and bless her heart, she's 84 years old, and she had one, and she said, "What is this? What is this?" And I said, "That's a good deed bump." And she said, "Honey, at my age, those are the only deeds I do anymore."
Oh, sweet. Okay, so when you talk about sunscreen, so everyone is talking about protect yourself because you do all these good deeds in the winter trying to get your skin back to this healthy, vibrant thing. What is the minimum number or what is the type of sunscreen people would need to wear? Because you need to do it on your hands when you're driving. I don't know if people know that.
And there's another sneaky thing that most people don't realize. The same thing that happens to your skin can happen to your eyes. So make sure you're wearing sunglasses with UV protection too. But there are really 2 components that you want to protect against for the skin, ultraviolet A and ultraviolet B. And traditionally, the SPF number that everybody's kind of keyed into was traditionally how long it would take for you to burn. So an SPF of 10, for example, if you normally could stay out for an hour before you'd burn, a 10 will theoretically let you stay out for 10 hours.
Okay.
But burns are just what's for redness. And that's caused by ultraviolet B, and that's how I remember it. Ultraviolet B burns, ultraviolet A, aging, wrinkles, and skin cancer.
Neither of them are
brown
good.
Spots. So the most important thing, it's not just that SPF number. You want to make sure that it has UVA protection. Most do, but not all. And if you're using something that just protects against ultraviolet B and the ultraviolet A is pouring in, you're setting yourself up for skin cancer, wrinkles, and brown spots.
Are you seeing a lot more skin cancer?
I am, and it's hotly debated why, but I think it's because people are much more educated and we're looking for it more.
Okay.
So is there...
And I tell you, the people that really get skin cancer now were my generation. We didn't know much about sunscreens. I mean, we had baby oil and iodine and
sure,
glitters,
yes.
and I had friends, they would get on the roof of their house so they'd be closer to the sun.
With tinfoil.
With tinfoil, yes, to focus the rays.
Is this SPF 30 UVA,
Perfect.
UVB, is it better to buy 70 or not?
No. 30 is fine. In fact,
Okay.
it's more of a marketing tool. After about 45, and I think the FDA has actually looked at limiting companies' abilities to say anything higher than 45.
Okay.
Anything higher than 45, it's less than 0.5% better. So it makes no difference except it costs 20 times more.
Yeah.
Got
okay.
it. Because
So
I
you want 30 with UVA. That's the key. And the key with sunscreens is you have to put them on half an hour before you go out in the sun because it takes 15 to 20 minutes to set up. And then reapply it every hour or more frequently if you're either actively perspiring or swimming. And
That's
I go to
good
the
to
beach
know.
and things. I just got back from Puerto Vallarta, and people go to the beach and they spread their blanket out, get their book ready, get their water set, and then after about 5 or 10 minutes, then they start spraying on the sunscreen.
Right.
Well, then it's going to take another 15 minutes to work, so they've already got a half an hour worth of sun.
Okay.
So the key is to put it on half an hour before you go out.
And the key would be, here would be the miracle, Dr. Crutchfield, if you could figure out how to do an infomercial to get boys and men to do that.
Yeah, because men don't want to
Men
wear
don't want to.
sunscreen, and they're aging, and we look better than the men.
Well, we can't stop that, but there needs to be a way to talk men into it. Okay, and there could be. 70.
I mean, I've got ideas, but yes, we can talk more about it.
Exactly. Okay, so what about retinoids? You know, about using retin-A products.
Retinoids are great. It was one of the first true dermatologic medications that really had good effects. Before that, we didn't really have much of anything. In fact, both my parents are physicians, and their whole medical school course in dermatology was if it was red, put a white cream on it. If it was white, put a red cream on it. If it was wet, make it dry. If it's dry, make it wet. If you don't want it, don't touch it. That was their whole derm course. That was it. You just heard it.
Highly effective. Good
So,
thing they were different types of doctors.
That's right. But now, and so retinoids and topical vitamin A products are really some of the first dermatologically active products, and it's really good at treating acne, and it's also good at rejuvenating the skin. But it was the first thing that we had that was good at rejuvenating the skin. We've got lots of other things that we use now, antioxidants, alpha-hydroxy acid. So it's one of the tools in the toolkit, and for some people it works like magic. So we still use it all the time.
All right, if someone put that on, can they use it every night, or how often would you suggest using that?
You can use it as tolerated, but I'll tell you a little trick that most people don't know about topical retinoids, from very mild to very strong. After about 3 months, they all work the same. It's just the strong ones will work a little bit quicker up front, but it's also much more irritating, so it's kind of a balancing act.
Okay.
So I usually recommend a real mild one, and because it's well tolerated, and you can certainly use it every day. But the key is it makes your skin just a little bit more sun sensitive, so make sure you wear a sunscreen with it.
You have to wear the sunscreen. All right, we have so much more, but we have to go.
Oh, okay.
I know. Thank you, Dr.
Well, that's
Crutchfield.
a lot of fun, and I look forward to talking to you again in the near future.
Absolutely.
Oh, yes. Oh, he's a good doctor.
I'm going.
I was just there today. All right, so we will take a